my name is Kurt Harper. I work with the Alabama Department of Forensic Sciences, and I'm the Toxicology Discipline Chief. So I oversee technical matters as well as the quality control program within toxicology. I'm also involved heavily with the method validation within the section, and I'm responsible for recommending hires and purchase of new instrumentation.
My name is Iyas Zaidan. I'm the sales manager at Ash'ala Medical Supplies. It's the Randox Toxicology distributor in the Kingdom of Saudi Arabia. Well, we're specialized and focused on the toxicology line, so we are covering or using all the products in the toxicology line. And since 2 years, we have been doing this business with Randox. We're starting the project with the Ministry of Health in Saudi Arabia, covering all poison control centers. And so far, everybody, and we can tell it has been a great success for everybody.
I am Nicholas Lemos, the Chief Forensic Toxicologist for the City and County of San Francisco. I'm in charge of the Forensic Laboratory Division. We take investigations on two types of cases, either people who have died in the jurisdiction, and we investigate if alcohol, drugs, and poisons had anything to do with a death, or people who are involved in the criminal investigations that take place in the jurisdiction as possible victims or perpetrators of crime. And again, we investigate if alcohol, drugs, and poisons had anything to do with the allegations. Well, we recently changed from a different manufacturer and different provider to Randox. The reason for us considering Randox was its flexibility with the analytes of interest, but also with the ability to customize chips to meet our specific needs. We have an evidence analyzer in the laboratory, and we use custom-made chips that cover a very big span of drugs that the San Francisco population seem to be exposed to or using.
Well, compared to other companies, Randox, and this is what Ministry of Health has realized, it adds a lot to the menu itself. Of course, it's offering a very broad menu. The speed, the sensitivity, cross-reactivity advantages, so many advantages, and it provided also a solution for so many problems that people were facing in the labs. Also looking at the possible sample types that labs can use, this adds a lot to the whole scenario.
2 years ago, we purchased the Randox Evidence Analyzer, and we use that for our post-mortem toxicology and human performance screening. We like the option of being able to customize a chip. It's also a fully automated system with sound technology and allowed us to address our backlog issues at the time.
My name is Raymond Van Orden. I'm a forensic toxicology supervisor at the Mesa Police Department Forensic Services. We are currently using the Randox Evidence Investigator, and basically we have it set up to screen a panel for most of the common drugs of abuse that we see in driving under the influence cases. This has given us the ability to test a lot more drugs of abuse that with our current system that we could not test for. I think one of the selling points is that it gave us a lot better cross-reactivity for a lot of different drugs. So we have, two biochips that we're currently running, one being a custom that allows us to give us a benefit of about 100 drugs of testing. Versus our other one, which gave us maybe 30 or 40.
One of the biggest advantages for moving to Randox that we have seen was the ability to conclude cases in a much faster way, because in our profession, it is important to complete investigations in both an accurate as well as a timely fashion. So being able to use an automated system that will drug screen for a vast array of drugs is a definite advantage over the competitors that we've used in the past. Additionally, another challenge, of course, is the constant changing of the drugs that are out there that we need to screen for. And the flexibility of Randox in including different drug categories on a chip is unique to Randox.
One huge challenge is maintaining a screen that can pick up new drugs as they evolve. So I think Randox has made an effort to stay on top of the emerging drugs from a designer drug standpoint.
I think it's saved, I would say that it's more efficient for our laboratory. So we're actually able to turn around cases quicker and get results faster.
Well, for me, it is about sharing knowledge, learning from what others have done, but also sharing our experiences, both on the Randox platform, but generally on other platforms. And so it is important for science not to be done in isolation. And so for me, this event is really an opportunity to share knowledge, learn from others, and also teach others from our findings and our experiences.